I'd like to talk about dentures, Dr. Chatterley. You know, when a person comes in and he did have dentures already, and the dentures started kind of, becoming wiggly-woggly, falling out, and very uncomfortable. In many cases, it seems the patient thinks that the denture has something wrong, when it really was the person's bones and gums which were shrinking, and that's why the denture didn't fit. It is just the same. Now, what option does a person have when that happens these days?
If their denture isn't really old and worn down, the teeth aren't, worn down, the first option is to reline the denture. If they've had the denture, 3 years, 4 years, 5 years, even 7, 8 years, and it's only slightly loose and doesn't hold quite as well as it used to, then if it's relined, which means we take an impression with the denture, and then the gaps that have formed from the receding of the gums and the remodeling and shrinking of the bone is then filled in, then that becomes like a new denture base and seals better and more closely than it did. So very often just a reline is sufficient to tighten up their denture and give them the function they used to have.
Okay. Now, I've heard that these days one can combine, and I call it a hybrid. It's probably not a good name in the medical society, but you can take a denture, put a couple, 2, maybe 3 or more implants in it, and by doing so have a whole different animal of a denture. Can you shed some light on that?
Oh, absolutely. A denture, an upper denture, can function quite well for 2, 3, for some people up to 5 years, but what's a good comparison? It's like a little league ball game compared to a major league game when you have implants that are placed to give rigidity for the denture to seat and can be made so it can actually snap into place onto the abutments or the attachments that are on the implants. And they have tremendously improved chewing ability and less problems than they had when it was, rocking and floating and particularly the lower denture. The lower denture is, I tell patients, it's a curse of dentistry. It's difficult to make a lower denture no matter how good of a ridge the patient has. And
what's a ridge, by the way? What's a ridge?
Well, the ridge is what's left after the teeth are removed, and it's a mound of the bone that's left that resorbs and remodels after the teeth are removed. Mm-hmm. And over time, particularly in the lower jaw, the lower area, that ridge recedes, and so over a long period of time, a lower denture is the curse of dentistry. It floats like a canoe. So
with an implant, it will not float like a canoe.
With an implant, it has a rigid fixation, and so it'll stay into place. It'll work. It improves it, between 10 and 100-fold.
So let me ask you. That's wonderful. Let me ask you. Can sometimes, if the old denture, person had a denture a couple, 2, 3 years or whatever, and it's not all that worn, can he still use the old denture and put an implant in it, or does he now have to have a new denture made also if he wants that implant option?
There are some mini implants that have been developed that can improve a denture significantly. If it's a very old denture and is really out of function, then they would need a denture remade to be able to achieve the improvement. So there's a array of choices there, depending on the condition of the existing denture and how loose it's become.
I got it. But it is worth for a patient who has a denture, let's just say it actually fits him still, he got it 2, 3, 5 years ago, maybe he whatever, didn't have the money for an implant. I'm sure you heard about it existing, that he goes and says, I want to keep my denture, and instead of having, 15 implants or whatever the heck a person needs, I take a couple, 2, 3 implants, keep my denture, and get, the next best thing, which is a lot better than just a denture, and obviously holds a lot longer, doesn't always keep, becoming wiggle-woggly. A person should go to a dentist and say, look, what can you do? I'm ready to do it with my old denture, so he doesn't have to pay for the denture twice. That's what I'm trying to get at.
Exactly. And definitely it's a viable option, and it can work out. So, have it evaluated and see. Even if it's the mini implants that are somewhat of a transition to the more permanent implants, it'll definitely give improvement to the function. It'll hold it to place.
Mm-hmm. And is it true that once you have an implant in it, as more the better, but at least you have those 2, 3, or 4 implants in it which keep the denture in place. So number one, it doesn't rub on your bones, it doesn't hurt, you can taste your food better, and it doesn't wiggle woggly. However, is it true that also because of it your bones don't start shrinking as much, so you become kind of like looking like a dried out tomato? Because the implant keeps the bone alive?
Yes, absolutely true. The bone that's around the root of the teeth is called alveolar bone, and the stimulus for it to be there are the roots of the teeth. Well, once the teeth are gone and the roots aren't there, then that alveolar bone begins to remold, reform, and recede. But if you put an implant in, the bone responds like it is a root of the tooth, and it has that stress that's created against the bone, and the bone responds, and it stays at the height, and it resolves doesn't completely resolve the recession process, but it very closely approximates what the roots stimulated the bone to do, and that's to stay there and not recede.
So basically, you're not only eating better, biting better, keep it for a long time because it doesn't wiggle woggly, so much more comfortable. So you also add to your good looks, basically.
That's right. Less wrinkles, less overclosure over time. As you've seen people over the years, and you can tell that they have a worn out denture because their mouth overcloses, and so it'll prevent that from happening. Beautiful. So yeah, you'll look better and less wrinkled and younger and happier, smile better. Besides function and eat.
Bite better, taste the food better. Hey, what more can you want? Thank you very much, Dr. Chatterley.
You're welcome.